So welcome to the exercise portion of the Light Force course. This is for you if you're a patient or for a clinician to use with your patients. We'll describe how the courses are intertwined with different exercises, and we're going to describe how each exercise is different and unique. When you start these exercises, you can then pair them with the exercises that are on my site, which are the PDF printouts of each exercise. If you have any questions, of course, you can always email me, but I think you're going to find this very self-explanatory and helpful. So the first exercise is called a pelvic rock. And what I want you to do with the pelvic rock is to visualize that your back is in the neutral position. And then I'm going to ask you to flatten your back and then find neutral and then arch up into extension. And I'm going to monitor this while you do it. And this is a great way to teach a patient what the neutral position is. If someone has spinal canal stenosis, you want to actually teach them to keep their back in a flattened position. But generally the research indicates that the neutral position is the most stable position for the spine. So this is for stability and strength and teaching of the neuromuscular concept of neutral. So flatten your back against my hand, good. And then relax and kind of find neutral, good. Now arch your back up to the ceiling, perfect. And then find neutral. And then flatten again against my hand, perfect, and then find neutral, and then arch up, and then find neutral. And when you're doing these exercises at home, once you find neutral, you can also tighten your abdominals to hold that neutral position when you're doing the exercises. And that's how you do a pelvic rock, to educate your brain and your back about the neutral position of your spine. So this pelvic rock exercise works for any type of problem because we have to learn how to keep our spine and extremities in a neutral position so we're balanced throughout our day. This pelvic rock is excellent for someone with herniated discs or any kind of stenosis or low back injury, because learning where the comfortable neutral position is very important. Like if you're standing, you don't want your hand like this or like this, you want it in the neutral position. That's exactly what we're teaching with this pelvic rock. Now we're going to do the single knee to chest maneuver. And again, just to remind you, all these exercises are available in a PDF on the website. This is a great exercise to increase flexion of the thigh. At the same time, it's good for loosening up the capsule of the hip socket and the acetabulum. And it's a great way of balancing any kind of extension maneuver like cobras and sphinx and things like that. So let's have you grab your knee with both hands. And you can have this knee bent or you can have it straight and gently pull your knee towards your chest. And then release. So when someone tells you that they can't sit cross-legged on the floor, or they feel like their hip socket hurts when they walk, they have a very tight hip socket. And that's why this can be very helpful for stretching that. Also, some people with central canal stenosis, meaning that the area where the nerves are, or the spinal cord, is tight against the nerves, flattening the back helps to actually improve the pain. So this is a great thing for people with all kinds of low back and hip problems when there is low back or hip pain. You can do the other side, of course, as well. And a major and important part of this is you only want to give exercises that make the patient feel good. How's that feel to you?
It's good.
Okay, so that's appropriate. And that's the single knee to chest stretch. So now we're going to do double knee to chest. And when someone has stenosis or a narrowing of this opening where the nerve comes out, that can be quite compacted and it hits the nerve root. And when you round the back, it gives that person more space. The same thing is true of central canal stenosis where the spinal cord is. Rounding the back helps that. Also, if the joints are arthritic and stiff, someone says they have a very stiff low back, this is a great stretch to open up those facet joints. Also, because it's flexion of the lumbar spine, it goes very well with the sphinx or cobra stretch where we give them extension of the lumbar spine. So why don't you grab both knees and gently pull them towards your chest. That's a great way to separate those joints in the lower back, give yourself a little more room or space, and relieve discomfort from stiffness.